Hi, everybody. This is Dr. John Osborne, the Chief Scientific and Medical Officer at ClearCardio. So, I'm going to tell you today about a really fascinating study. This is the first double blinded, randomized, placebo controlled trial of a very, as it turns out, a very powerful intervention shown to reduce the risk of cardiovascular events, all cause mortality, and cardiovascular death. And in fact, this is on top of all the other usual pillars of prevention that we use day in, day out, or at least we do at Clear Cardio to keep people healthy, happy, and above ground, such as medications to treat cholesterol, blood pressure, diabetes, blood thinners, aspirin, all of those things. So I'm going to walk you through this trial. I'm going to show you the benefit of this particular intervention, but here's the hitch. I am not going to tell you what the intervention is until the very end for two reasons. One, you're going to be shocked. Number two, I like to keep everybody on tenterhooks and excited to hear the rest of the story. I hearken back to the famous Paul Harvey, if you're old enough to remember Paul Harvey, where he'd tell you the story and then he'd give you the punchline at the very end. So I'm going to do the same thing with the intervention here. So what they did in this trial, I'm just going to call the intervention. And at the end of this talk, I'll tell you what that intervention is, and you're going to be completely gobsmacked. So let me walk you through this. So this was a study that was published now about 4 years ago. It was first presented at the European Society of Cardiology meetings in 2021 during COVID. It was a virtual meeting, by the way, because of COVID. So this is called the IAMI trial. I'm not going to tell you what that stands for because I'd blow my punchline. But the IAMI trial. So what the AMI stands for, they took about 2,500 people who'd had a heart attack in the last 12 months. Okay, so this is a very high risk population for recurrent events, for more stents, more balloons, more bypass surgery, and strokes, etc. So they took these 2,500 people. Now, appreciate, before getting into the trial, we all knew they had heart disease. Therefore, they're on cholesterol-lowering drugs. They're on blood pressure drugs, if appropriate. They're on diabetes drugs, if appropriate. Most of them were all on one or two blood thinning medications because a lot of these people had stents as well. So this is all a high-risk population, but they're already treated with lots of the proven pillars of things that prevent strokes and heart attacks. Again, blood pressure, diabetes drugs, cholesterol drugs, antiplatelet drugs, etc. So all of that was in play. So they're on all of these pillars of prevention. Then they randomized these 2,500 people to placebo, which on these graphs is going to be shown in red, or to the intervention, which is going to be shown in blue. The trial only went for 12 months. Now, because of COVID, they had a lot of trouble recruiting people, so the trial only went to 12 months, so they anticipated to take longer. But even in the short span of just 1 year, they showed a really remarkable benefit, and I'm going to walk you through each one of those three major benefits right now. So the trial was done, and as we say in the statistical world, powered to look at cardiovascular events. So this was more stents, more balloons, more bypass surgeries, more heart attacks, etc. So they were looking at what we call composite cardiovascular events, lumping all of those together, and that is this chart in the left upper corner. So what you can see is two things. One, the blue line that got the intervention, the lucky people, versus the red line on placebo, there was a dramatic reduction in the risk of composite cardiovascular events over a span of just 12 months. Also note, if you look at the curves here, going to the left-hand corner, and you'll see this repeated with each of these three endpoints I'm going to share with you. If you look at the curve down here at the beginning of the trial, what we saw is that the curves began to diverge very quickly, which meant that we didn't have to marinate for a long time in this treatment. That is, we didn't have to get the treatment and then wait days, weeks, months later to see the benefit. We saw the curves began to diverge almost immediately from the get-go. So here you can see this is 3 months, and you can see already substantial benefit in terms of the people who got the intervention in blue versus those on placebo, shown here. So big benefit, a 28% reduction in composite cardiovascular events. That's a whole variety of different cardiovascular events that we want to avoid. 28% reduction, highly statistically significant as well, and occurred over a pretty brief period of time, just 1 year, and the curves began to diverge very quickly. So this is what I call being front-loaded. The benefit is front-loaded. I also call this, I'll laugh at this, my terminology for this is I call it the antibiotic-like effect. So just like if you get an antibiotic for a pneumonia or a urinary tract infection, you anticipate you'll get better within days. You don't wait weeks or months. So I call this rapid divergence here, showing benefit rapidly and early upfront to be, I call it the antibiotic-like effect. Now, they also looked at two other very important variables here. One was the next one, which is the right upper quadrant, was very simple. This is all-cause mortality. So, in other words, how many people were breathing and had a pulse at the beginning, which was 100%. How many people just 1 year later were breathing and had a pulse 1 year later. What they showed for all-cause mortality, a 41% reduction in all-cause mortality. And again, note, the curves began to diverge very promptly. So the benefit was front-loaded. Lastly, looking at this curve in the left lower hand corner is cardiovascular death. This is death due to either a fatal stroke or a fatal heart attack, basically. So again, a 41% reduction in cardiovascular death over the span of just 12 months. And again, the curves began to diverge very quickly as well. So you're wondering, what is the blue line? What is the intervention that I've been talking about? What is giving a 28% reduction in cardiovascular events, a 41% reduction in all-cause mortality, a 41% reduction in cardiovascular death? Are you ready for this? Are you sitting down? The intervention here was a flu shot. Yes, that's right, a flu shot. The reason I didn't say a flu shot up front is we're in interesting times. I think we all went through COVID. We have different opinions on COVID and all that. I'm not going to go into all that. And the reason I bring this study out is I'm always constantly looking, going through the literature, reading voraciously to find all of the different ways that we can add one on top of another to lower your risk of cardiovascular events, strokes, heart attacks, preventable strokes, preventable heart attacks, preventable balloon stents and bypass surgery, and of course, ultimately, cardiovascular death and all-cause mortality. As you well know, we have lots of proven tools that allow us to make people live longer, to stop plaque, to reverse plaque. Most importantly, those also show reductions in balloons and stents and bypass surgeries and heart attacks and strokes and cardiovascular death and all-cause mortality, depending upon the intervention. But this is an amazing intervention with a huge benefit for something as cheap and simple as getting a flu shot. So, as you can imagine, uniformly, I always tell all of my patients, please get a flu shot. Get it every year. They're usually going to be available come late August or September. Get your flu shot. And I'm going to put it in a frame of reference. Get your flu shot to lower your risk of cardiovascular events. Now, you can say, and I hear people say, and that's why I told people at the very end what the intervention was, because unfortunately, there are a lot of people that go, I don't want to hear anything about vaccination, whether it's the flu shot or any other shot. I don't believe it. I've lost trust in the system. I get it. So the reason I like to I'm going to show you the benefit, then I'll tell you what the intervention was. It was a flu shot. I learned my lesson when I tell people up front, hey, get a flu shot, this is why. Once I said flu shot or vaccination, they'd immediately turn their brain off and were no longer engaged and wouldn't listen to me. So I did a little trick on all of you. I showed you the benefit, and at the very end I said, this is a flu shot. Pretty impressive data. First double-blinded, randomized, placebo-controlled trial of a flu shot as a cardiovascular risk reduction agent. So my joke is about the flu, I know many of you have never had the flu shot. Many of you are against getting the flu shot. I'm just arguing, get your flu shot as a cardiovascular risk reduction tool, as important as controlling your blood pressure, losing weight, diet, exercise, treating cholesterol, blood pressure, all of those other things that translate to people living longer, living better, avoiding terrible things like strokes, heart attacks, sudden cardiac death, and dying early. So the flu shot is a proven cardiovascular reduction tool. By the way, several other trials in the meantime were published after this, double-blinded, randomized, placebo-controlled trials looking at the role of flu shot as a cardiovascular risk reduction tool. They were also positive as well. So we have multiple trials indicating the benefit. Again, think of this as a cardiovascular risk reduction tool. You need not think of it as a tool to avoid the flu necessarily or make the flu less bad, which the flu shots probably do. Your mileage may vary. Again, this is a cardiovascular risk reduction tool. Think of it that way. And my joke is, as a cardiologist, whether you get the flu or not, I frankly don't care because I'm interested in balloon stents, bypass surgery, heart attack, strokes, and sudden death, and cardiovascular mortality. So, again, I'm kidding about that. Of course, I don't want you to get the flu either, but really think of this, the flu shot, as a very important foundational tool added to all of the other tools that we will discuss and come up with your own bespoke, customized, personalized set of strategies that we're going to use to keep you healthy, happy, and above ground, to lower your risk as much as we humanly possibly can of the preventable cardiovascular events that still currently kill 45% of us. Let's really dramatically reduce. And we have incredibly effective tools both on the therapeutic side and proven tools, but also the tools of ClearCardio with early detection, using AI to detect disease, to detect plaque, long before it ever causes symptoms, long before you flunk a stress test, long before you need stents, balloons, or bypass surgery, and of course, most importantly, long before your first symptom, which only occurs in half of people with heart disease. The first symptom of half of people with heart disease is a sudden catastrophic event that could be a heart attack or worse, sudden cardiac death. So please, let's work together. As I say all the time, there are very, very few preventative cardiologists. So I need help. I'm going to lean into you. I'm going to ask your help to work with me to eliminate heart disease. And ultimately, I'm going to lean into you and ask you a big ask. Please work to put me, as a preventative cardiologist or cardiologist in general, out of business. I think we're still going to have our work cut out for us, but I love to find new tips, new tricks, new data, new evidence that allows me to continue to ratchet down the risk of cardiovascular events, of preventable cardiovascular events that still kills nearly 1 million people year in, year out in the United States. That's about 1 million too many. Please spread the message. Again, I tell people, share this data, share our YouTube link, ClearCardio on YouTube. You can check out clearcardio.com, www.clearcardio.com. Lots of data, lots of cool videos, lots of information about how you can determine if you have plaque long before you have symptoms, flunk a stress test, or have a serious, maybe even fatal cardiovascular event. Work to put, as I like to say, work to put cardiologists out of business, work to put me out of business, and I think this is a really dramatically effective additional tool that we have in our armamentarium to help put an end to cardiovascular disease. So make my day. Please work to put me out of business. Share this with friends, family, anyone you love or care about. I think this is a really important message to get out. If you do not love them, do not like them, do not share this. But if you love them and like them, please share this. Of course, I'm kidding about that. But please work with me. We are absolutely dedicated and passionate to lower your risk of probably the most preventable cause of death and mortality or morbidity in the U.S. And by the way, globally, 20 million people a year, year in, year out, die of fatal strokes and fatal heart attacks. Please work, all of us together, to spread the message and help to eliminate heart disease in our lifetime. This is Dr. John Osborne, the Chief Medical and Scientific Officer of ClearCardio. Please work to put me out of business.